Our spotlight webinar today is the treatment for movement disorders that dentistry doesn't often think about, and I think you're really going to enjoy the kind of information that we're going to be offering today. Carla Gantz has been with us at CareerFusion since at least 2008, and she is bringing with her today her employer, her previous employer, Dr. Funk, and you'll get to learn about their story in just a couple of minutes. I would encourage you, if you have questions, to type them into the little box over here on the right, and we will answer all of the questions at the end of the program. So don't worry if we don't get to your question right away, because we're saving them up to the end so that the speakers can go through and deliver their message. So Carla, I'm going to be turning over the screen to you right now.
Okay.
And Carla Gantz.
Thank you, Shirley, and thank everyone out here for coming out tonight. I know it's a missio night, but I want to share with you on how I found relief. It is the connection between TMJ and the neuromuscular disorder. What we want to cover tonight, we're going to discuss briefly what is actually Parkinson's disease. I think it's very important that we cover the signs and the symptoms. And then we're going to talk about my quest, the search that led me to where I am. We're going to discuss the common TMJ causes and disorders, the connection, and then Dr. Funk will speak to us about my mouthpiece. But let's start off first with what is Parkinson's disease. And actually, Parkinson's disease is a brain disease. It is not contagious. It is a chronic progressive neurological condition, and it's resulting from the degeneration of dopamine-producing neurons in the substantia nigra. However, it is unclear why the brain cells which create the dopamine stop working. But they say by the time the Parkinson's disease symptoms appear, they believe that around 80% of the brain cells are no longer functioning. So let's talk a little bit about these symptoms that appear. Actually, there are four main symptoms of Parkinson's disease. There's the tremor, the bradykinesia, the rigidity, and the postural instability. And you have to have at least two of these symptoms before being diagnosed with Parkinson's disease. I ended up having three of them. The tremor was very obvious with me that I knew that I had, but I soon learned that my frozen shoulder that I was having trouble with was due to what's called the rigidity, and I was totally unaware that I had the bradykinesia. Now, rigidity, some people refer to it as a tightness, like the stiffness of the arms or the legs, and rigidity can kind of feel like the stiffness of arthritis, but it has no association with pain. Muscles normally stretch when they move and they relax when they're at rest. However, someone with Parkinson's, the rigidity, the muscle tone always feels stiff, they do not relax, and it hurts. It is just tightness all the time. Looking back on things now, I realized that it was rigidity that was going on with my right arm when I was walking. I had noticed a decrease in the swing with my arm, and I had blamed it on being out of shape and getting older, but that wasn't what was going on. Bradykinesia, I was not aware that I had. Brady means slow, and kinesia means the movement. And the test for bradykinesia is really how quickly the person can tap their finger and their thumb together. Or they'll actually ask you to tap your foot up and down. This is actually one of the most disabling type of symptoms for Parkinson's person. One moment you can be walking down the street and you're moving real easy, and then the next minute you just kind of freeze up and you stop. And this is what was happening with me as a hygienist with scaling and polishing. I would be inside someone's mouth, and then all of a sudden my hand would just freeze up and it would just stop. This is called the pull test, And the checking with the impairment of the balance and the coordination, the doctor is checking the patient's ability to recover. People with the balance problems, they have a difficulty in turning, in making abrupt movement. This because with this, they have a tendency to want to develop a forward or a backward lean, and they fall real easily. Tremors, 70% of people with Parkinson's disease will have tremor. And 3 out of 4 patients, the tremor actually affects only one side of the body. And that's especially during the early stage of the disease. Tremors usually starts in one hand, and usually sometimes in a foot or at times even a jaw. The tremor, it's most obvious when the person's at rest. A Parkinson's tremor, a true tremor, is when we try to go to rest or to sleep. Essential tremors are right opposite. Essential tremor people, tremor will not affect anything upon resting, but it tremors when they go to work. The warning signs, I think it's real important for us to review the warning signs, and I just ask you to kind of keep these in the back of your mind this evening as we go through this. People with normal sense of smell can usually identify about 35 odors. Sometimes people with Parkinson's can only identify 20 odors, and sometimes less than that. Dizziness, the feeling, the dizzy or faintness, can be a sign of low blood pressure, and that can be linked into Parkinson's disease. When I was first diagnosed, I was diagnosed with essential tremors, and they treat essential tremors with blood pressure medication. Well, I already had low blood pressure, and when I was being treated with essential tremors, I slept all the time, and I had no energy whatsoever. And like I said, with the early tremors, it can show up in your finger, it can show up in your thumb. With Michael J. Fox, in one of his books, he speaks about how the tremor showed up in his little pinky finger. And for me, it was my right hand. Trouble sleeping. Sudden movements during sleep may be a sign of Parkinson's disease. People, the thing that they do what they call a thrashing around in the bed or kicking while they're sleeping. Sleeping is a huge problem with Parkinson's disease. And constipation. Do you have trouble with constipation? With some people with Parkinson's disease, constipation may occur due to the functioning of the autonomic nervous system. If this system is not working properly, it's like the rigidity gets inside the intestines and things just don't move. The soft voice, people's voice may become very soft, or it may become very coarse sounding. Now, Katharine Hepburn, I've had a lot of people ask me if that was what was wrong with Katharine Hepburn. From the research that I have done, it looks like Katharine Hepburn had essential tremors that had affected her vocal cords. Are you standing up as straight as you used to? You may have family members that notice that you're stooping or that you're leaning or you're slouching when you stand, and that could be a sign of Parkinson's. Have you been told that you have this serious, depressed, or even mad look on your face when you're not in a bad mood? This serious look they call is masking. Sometimes people have that blank stare. They get to where they don't blink their eyes very often. Moving or walking. This is like I was saying earlier, your body feels real stiff and your arms and your legs just don't want to move. People describe this as being stuck to the floor, and people have even made the comment to you that, you know, you look a little stiff. What's going on? Handwriting, this was one of my signs also. We were still in with the charts at the time when, just before I was diagnosed. My penmanship was about the size of the 10 font on your computer. What happens with your handwriting, this comes on very suddenly, as to where aging, it will gradually come about. People, they they put this thing off with the handwriting as they get older because they blame everything on age. So those are the 10 warning signs. However, I want to show you, talk about pain. Pain is not one of the top 10 listed, but however, the pain in Parkinson's, it can take on several different forms. It can have a dull ache, it can have the persistent nagging ache. It's usually restricted to one area at a time. With me, it was on my left shoulder. However, as time has gone on, I have had a pain in my right leg. It just above my knee, but in between my knee and my thigh. And it has hurt for about 18 months. And there were times when walking was the only thing that I could get relief from the pain that I was having. I think it's important that we mention depression. Depression is one of the major and the most common difficulty things that people with Parkinson's will experience. At least 40% of them will sometime have clinical depression. They believe the reason is the combination. They think of the living with the stress of the progressive chronic illness and even the change in the neurochemistry of the brain that goes along with Parkinson's disease. We know there are just some things in life that you never forget. And I will actually never forget the day that I heard the words that you have Parkinson's disease. And I can remember looking at my doctor when he was telling me this, and it was as if he was just going off into a barrel or something. I remember his voice just kind of got muffled, and I described it kind of like a Pink Floyd song, you know, where Pink Floyd song goes, your lips move, but I can't hear what you're saying. I felt as if I was actually going numb, but thank goodness the good Lord got a hold of me and says, listen, you need to straighten up. You need to listen to what this doctor has to say because this is very serious. And it is very serious. He was explaining to me that my Parkinson's is only on one side of my body. However, he goes ahead and he explains to me. He says, Carla, we can control this with medication. It's going to help your handwriting. But because of my frozen shoulder, he felt like it would be best for me to start into physical therapy. So we discussed several different types of medication, and we ended up deciding to take the Requip. Now, at the present time, I was working 3 days a week. I was in a cosmetic practice, and I had developed the assistant hygiene program. So I was seeing anywhere from 8 to 10 patients a day, of course, depending upon the treatment. So my medication was working beautifully. It was controlling my tremors. My shoulder was in good shape, but what happened was the Requip kept making me nauseated, so we did have to end up changing over to the carbidopa-levodopa. But, you know, it didn't slow me down. The medication, it was working. I was doing good because actually, you all, 7 days after my D-Day, here I am in Louisville, and there's Shirley. I was actually first vice for the Kentucky Dental Hygienists Association, and my job description was the event planner, and I had Shirley and Patty DeGangi as speakers. My medication continued to work. The next year I was installed as president. I attended ADHA as a delegate from Kentucky. Yes, it was a chronic disease, but I was doing good. But little by little, the Parkinson's disease started interfering with my role position as a dental hygienist. And actually, the first thing clinically I had to give up was my local anesthetic. So one day, I'm actually looking through an RDH magazine, and I find this right here, CareerFusion. Look at this. There's Shirley again, and there's Beth Thompson. I met Beth at under one roof. I knew she was editor of Contemporary Hygiene, and this ad asked questions like, is your career changing? Are you changing? Are you thinking about working outside of clinical? And I got to thinking, you know, Parkinson's disease, it's a chronic disease. You know, I really need to check this out before something happens. Well, it happened. Reality happened, and it happened very quick. My tremors had reached the point where they were just very unpredictable. I was losing my dexterity, and honestly, I was getting dangerously because trying to flip an instrument was not a good thing when you do not have dexterity in your hand. My hand was freezing right in the middle of a mouth when I was scaling or polishing. And, you know, I had shared with a few of my close patients my situation, you know, and not because, you know, I didn't want to quit the career that I loved. So I actually rescheduled a few of the people, but, you know, that was not fair to the patient nor the employer. So this is the chart showing my medication. And like I said, for 5 years, you can see here where the carbidopa-levodopa regulated my tremor in my right hand. But as my symptoms increased, so did my medication. Well, by March of 2012, I was taking 13 pills a day. And one of the major problems with levodopa is that after 4 to 6 years of taking this medication, about 40% of the patients develop dyskinesia. And I'm thinking, you know, I really do not want that. And so this is what started what I call my quest. It was time for me to check into something else. And a couple of years back, a good friend of mine, Stephanie Wall, she had come across this newsletter from the Parkinson's Resource Organization. And when Stephanie sent this to me, Parkinson's disease had not taken anything away from me. I was still doing good. I was practicing, and I just kind of quickly looked over it and filed it away, actually. But I decided, you know, it was time to go back and read that article. And look at what this article tells me right here. It tells me that there are symptoms that have been described as being Parkinson's symptoms that quite possibly come from a malaligned jaw or bite. And I'm thinking, is this real? And look at these signs and symptoms here. These are the ones that we just reviewed. It goes on to tell about how individuals who had been keeping track of their symptoms before they started TMJ therapy and while in their TMJ treatment actually had some symptoms to go away. Now, this article stresses that this is not a cure for Parkinson's disease. And it goes on to cover the part about what is Parkinson's and the cause. But now listen to this. This is what got the old light bulb going off with me. What if these symptoms were caused because the trigeminal nerve canal was pinched between the temporomandibular jaw joint and the ear bone, not allowing the conduction of the instructions and activity to and from the brain to the rest of the body? Well, what if these symptoms were caused because the external carotid artery was pinched between the temporomandibular jaw and the ear bone, not allowing the flow of blood and oxygen to go to and from the brain? Remember me mentioning by the time that the Parkinson's disease symptoms appear, it's believed that 80% of the brain cells are no longer functioning? Well, yeah. I mean, if blood and oxygen is not going to my brain, then there's a lot of things that are not functioning. And again, looking back, I recognized the symptoms like my arm was not wanting to swing. But now I'm questioning, is it possible that some of my symptoms are not Parkinson's related? I mean, I grew up on a farm. I was around pesticides all of my life. But I've also been in dentistry for 30 years. And I know of 2 people that have had TMJ surgery while the rest have received relief by wearing a custom-made appliance. I mean, think about this. By wearing an appliance that would do this, it means it's non-invasive, it's non-surgical, and it's non-pharmaceutical. Let's move on. I go back to the website and I find another article, and it's entitled, Why Dentists Can Help Restore Quality of Life in Those Suffering from Parkinson's Disease. And look about this, about how they are already reporting reduced pain level, less fatigue, and better sleep. And what about the relief of this dyskinesia? Didn't we just talk about the dyskinesia, the carbidopa-levodopa, that after 5 or 6 years there's a 40% chance that you develop this carbidopa-levodopa? And this gentleman, Dr. Brendan Stack, that's a name you need to remember. And I keep thinking, could this help the pain in my right leg? And is movement The only problem, look at this. Japan did a study showing the chief complaint here that patients with severe motor disturbance and severe pain is pain rather than the motor disturbance. And I keep thinking about my pain while I'm reading all of this. So I find another one. Every time I go back to this archives of these newsletters, I find all of these connections. Temporomandibular disorder. Is there a link to Parkinson's disease? One of the core features of Parkinson's disease is sleep problem. And without quality of sleep, all of our problems get worse. The poorer you sleep, the more pain, and the more pain, the poorer you sleep. Guys, I'm a poster child for this. I'm up walking around all night, all hours of the night and early morning because of this pain in my leg. And here's another one. This doctor did a study on TMJ patients where he measured the amount of forward head posture and found that they were on an average over 4 inches forward. Every inch forward placed 10 pounds on the cervical spine, which means that it might place as much as 40 pounds of stress on the neck. He explains that when you place the jaw in its correct joint position with splints, it's going to correct the cervical spine. And when looking at someone with Parkinson's disease, you notice that the same forward head posture and the shoulder roll is much like that of the advanced TMJ patients. This article I found, it's a section from Dr. A.C. Founder. It's called the Dental Distress Syndrome. And look at this. Your head held in a forward position can pull your entire body out of line. And it can reduce the lung as much as 30%. And he also writes about the gastrointestinal system, how it's affected, and wasn't constipation one of the warning signs? And he goes on down and he mentions with a hunched position, the body becomes rigid. Well, rigidity is one of the 4 cardinal signs of Parkinson's disease. And look right here. Since endorphin production is reduced, an increase in pain and discomfort results. Oh my gosh, guys, this is just unbelievable. Then I find this article by Dr. Dwight Jennings. He writes that there are case histories from multiple dentists showing that neuromuscular orthopedic repositioning of the craniomandibular relationship is affected in some cases at stopping many symptoms attributed to Parkinson's disease. And the symptoms such as tremor, rigidity, depression, dizziness, fainting, loss of smell, insomnia, and weak voice. Are all of these sounding familiar to anyone? So I leave this website and I start Googling everything. And I run across this book by Dr. Lawson, and he actually has a page in this book titled Parkinson's Disease and TMJ, A Mysterious Connection. And he talks about, as strange as it may seem, that there's an increasing evidence that people diagnosed with Parkinson's have the likelihood of having TMJ dysfunction, and that proper treatment of this disorder by a qualified dentist can help alleviate the symptoms of the disease. He also stresses that this is not a cure for Parkinson's, but he also goes on and says the results of correction of a jaw dysfunction in many cases have actually reduced or eliminated symptoms of Parkinson's disease. My head is just spinning because I keep all of this information. Those symptoms include a long list going well beyond the hand and body tremors and slow movement or shuffling of feet. The exciting part is that this treatment does not include drugs. There's no side effect, but it involves the use of a special mouthpiece to correct the jaw relationship. He goes on and explains that when the relationship of the jaw is corrected, many nerves and blood vessels at the back of the jaw joint are no longer being pinched, and they can be restored to normal function. The area in the back of the jaw joint accounts for the blood vessel that goes directly to the brain. Okay, this is making a lot of sense. People with Parkinson's disease have a low amount of dopamine in the brain. This lack of dopamine can be the result of a chronic brain stress due to postural misalignment body structures, especially the jaw joint and the bite. At this point of my research, I am overwhelmed. I had to take a break. I had to stop and think. I asked questions. I researched this for weeks and months. And I kept asking myself, could some of my Parkinson's symptoms not be Parkinson's symptoms? So I decided it was time to also brush up on my TMJ symptoms. And look at this. The ones that are highlighted, they're mine. I have several symptoms of TMJ. So now what? Well, it's time to call in the Cavalry. So I picked up the phone and I called my former boss, Dr. William Funk. Dr. Funk, he has been successfully treating temporomandibular joint disorders for over 30 years. And during my years of working with him and his wife, they were always very supportive. This is actually a picture where they came when I was installed for president. So we talked, and I emailed him every article, every newsletter that I had come across, and I asked him if he would look over this and get back with me. And I said, you know, I really would like to know what your thoughts are. So that brings us to our first poll question.
All right, yes, we're going to start with the poll question. If everyone would just take a second and, oh, we got a little typo there. Did you know about the TMJ connection before this webinar? We're just curious to know what the attendees at this little webinar, what their experience is and what their thoughts are. So if you'll just take a second and say yes or no. We've got a little over half of you have voted. And in about 10 more seconds, we'll press closed, and then we'll reveal the answers for the big reveal. Okay, we've got over 80% of you have voted. So let's go ahead and close this, and then we'll hit share. And you can see what the answers were. 61% of the people who are joining us on this webinar had no idea that TMJ had a connection with Parkinson's disease, and 39% said they did have an idea. So we've got a pretty good mix here, I think.
Yes.
So we'll hide this and we'll go right on with the rest of this webinar. Thanks, Carla.
Okay, now I'm going to turn it over to Dr. Funk. Hold on just a second. Let's get this going again. And here he comes with the search.
When Carla called me and told me that she had information that possibly my TMJ training could help with excuse me, could help with her Parkinson's. Oh, Lordy, what she'd been drinking or something. There's no way in the world. But anyway, she wanted me to research it a little bit and get back with her. So I did, and at her suggestion, I called Parkinson's Resource Organization. And they were real nice, extremely nice, and told me some people to contact, which I did, and finally contacted Dr. Stack in Virginia. And Dr. Stack I asked him if I could come down there and visit with him sometime. He said sure. And I did some other calls, and it seemed like there was possibly something to it, but I still couldn't possibly imagine that it was. But I was wrong. Here's Dr. Stack. He's not nearly that mean the way he looks. He's a lot nicer than that. Not a whole lot nicer, but kind of nicer than that anyway. So I went to shadow him and a day, and he told me that when I first walked in the door and met him, I said, I've been through all the banking curriculum at that time years ago, and even taught there for a few years, and I pretty much know about occlusion. He said, well, you can forget about all that, because we're going to learn something different. I Now what? Because I've been doing that for 25, 30 years, I guess, 35 years, for a number of full mouth reconstructions and whatever. Had really good luck with that, but no movement disorder treatments at all that I knew anything about, at least. Excuse me. So I stayed with him for a day, and then I came back to Bowling Green and thought I probably had learned enough possibly to go and make appliance for Carla, as I had learned from him and some other people around the country as well, but he's the only one that I had visited at that time. Here's a picture of the normal jaw joint. There's the muscle that pulls the disc. There's the disc. There's the ear bone, and there's the lower jaw bone. That little holes in there where they're cut right in half, right below your ear. This right here, right there, is the disc, and the muscle pulls the disc forward with it here. When you open wide, and it then releases it, and the ligament behind the disc. Carl, where this little thing? Here you go. The ligament right here pulls it back. The ligament's like a rubber band, and the muscle gives and quits giving. I mean, pulls and quits pulling, and that controls the disc pretty well. So this is a displaced joint where the disc is kind of wadded up in front of the ear bone and the jawbone, and now you have some structures in here that are being pinched between these two bones. Here is the external carotid artery, which goes right up between the ear bone and the jawbone. Here's the jawbone, and here is the ear bone. Here we have a retruded condyle. Now, once again, the condyle is retruded because the disc up here is kind of watered in front and pushing, and there's only so much room up there, so the disc is now pushing the jawbone back. And that's what you see here, back against the ear bone and pushing, it's squeezing the artery pretty bad and cutting off a lot of circulation to the head. Then we have the same picture, except right here is where the disc is forward. Therefore, there's no more room for the condyle or the ball to go forward, the ear bone, the jawbone to go forward. So it's pushed back against the auriculotemporal nerve. Both the artery and this nerve go, among other places, right to the brain. Here again we have a picture of the jawbone, ear bone, disc, ligaments, and muscle. And here we have one that moves. There is the ligament, that yellow thing. There's the jawbone. There's the ear bone. There the muscle pulling everything forward. And there is the ligament pulling it back again. So the situation we talked about is the disc stays here when the jawbone goes back and squeezes structures right up in here. That's what we're talking about. So it makes sense. I'm sorry. It makes sense that the treatment would be to simply pull the jawbone down away from the ear bone just a little bit and make room for those structures to function, which is exactly what we do. Here's Carla. It was just on a minute ago. It shows her teeth end to end in the front, which means she's like biting her fingernails. And here she is with popsicle sticks or tongue blades. And what you do is put in so many, and you just watch her hand. She watches her hand or arm, which is moving. It was moving quite a bit at that time. And when she said she starts feeling something. She can't describe it, but something that feels strange to her. And one more stick is all it took for her, and I think that was 5 popsicle sticks. We added one more to the pile here, and the treatment, I mean the movements quit 60 or 70% just in a matter of minutes. So here she is with the plants in her mouth. That's acrylic. Carla's a coffee drinker, and you can tell it used to be nice and pretty, but now it's not. There is her her opening with the appliance in. There's another picture of it opening in. And here it is with the appliance out. So you can see the difference, how wide she is open there. Here we are putting the sticks in. My assistant is in her mouth. And here I am marking with articulating paper or carbon paper. And here's what the splints look like. This is the first try that we did. It's here and here. And here is the finished product, where it's only supposed to hit twice in the back, one on each side equally. Now, with once you get to the right height, this should greatly improve her problem. The problem is, over a period of time, her upper teeth will wear this thing down. So she has to have them built up every now and then, which is no big deal. Every month or two or three, come and build them up just a little bit. That's just a few minutes. The same treatment, a very similar treatment, is the same as treated for the treatment all these diseases. All these are neuromuscular movement diseases. And a problem that we kind of run into is that these things, these medications here will mask. They're necessary for various things, but the problem is they will mask some TMJ symptoms that a patient might be having, so they don't know to come to us because the jaw is not bothering them any, and Carla's wasn't either for that matter, but she wasn't taking any of these things. But anyway, that happens frequently. I think these medications just mask so they never come to the dentist. Poll question.
And we're ready for a poll question, Shirley. Thank you, Dr. Fox.
So let's get ready to get this next poll question underway. And we'll be asking whether or not you do a TMJ exam as part of your exam. Do you go through all of the steps of a TMJ exam, or do you do it in kind of a quickie way? Got about half of everybody voted. I don't get to vote. It says organizers and panelists don't get to do it. Sorry. Okay, we got another couple more seconds for a couple of more votes to sneak in before we shut her down. Okay, and we can close that and share the results. And it's pretty close. 52% of the people who have joined us today say that they do a TMJ exam, and 48% say that they normally do not. So that's pretty 50-50-ish.
Yeah.
And we can hide that and go right along. Thanks, Jody.
Okay. Now, let's talk about the results. And I'm going to talk about my magic number. My magic number was 6. It was 6 of these sticks that helped me get the relief that I'm getting. Now, what I did is I just went out and purchased a package of the craft sticks, and my husband glued some together and some we used the rubber bands. Now, I started off with just 3 sticks in my mouth, but I really couldn't feel any change. I couldn't see any change. Mine was a gradual. There are some people that it's almost like immediately when they put these sticks in to where it positions your jaw, what they'll do is they'll have you to bite end to end, like that picture that Dr. Funk was showing you, and then it's at the end-to-end position is when they will place the sticks in. Some people get instant relief. I did not. However, mine was a gradual thing. I stayed with it. and I worked myself up to where I figured out that 6 was my magic number. Now, when I say that the sticks, I kept these things in my mouth all the time. Now, no, I did not sleep with them. And we have a German Shepherd that loves to fetch, and every afternoon we would meet my husband when he would come in from work, and we'd both have sticks in our mouth. And he'd just shake his head, and he, he'd say, okay, who's going to fetch what sticks first? But my point being is that because I did not give up on the first a couple of times. You may have to work with this. I worked with this actually for 2 weeks before I finally called Dr. Funk. Once he had told me what all I needed to do, it took me about 2 weeks before I said, hey, I know exactly what my number is. And what happened, my results, the pain in my right leg, it is now gone. However, if I go without my appliance, I say an hour or so, I start feeling that strange sensation in my leg. And again, I can't describe that strange sensation, but I know that if I go without it very long, I'm going to get back into the pain. Now, I get it back in, I put my appliance back in, and the pain will go away. My stiffness in my shoulder is gone. 5 years ago, we bought a hot tub because of all of my sore muscles and everything. And we were just discussing last week, we haven't even filled up the hot tub this winter just because I haven't felt the need that I needed it. My sleep, I'm staying in bed all night. I am no more walking circles around our kitchen bar, and I feel good in the morning. My tremors, I'll say they're 80% reduced, and the muscle tenderness in my right arm is much better. The rigidity is much better. However, I have found that working on a computer, the mouse, it aggravates my arm, and it triggers the tremors too. So I really have to limit my use of the computer mouth. It just aggravates everything. Now, being a hygienist, I cannot just not say anything about oral hygiene. Because of our Parkinson's medication, I do have to just touch base just with a little bit. All of the Parkinson's medication causes dry mouth, and the dry mouth is going to increase the risk for decay and periodontal disease. So you will have to brush your teeth more after every meal and before reinserting the appliance. And you know that getting cavities, it is the result of a bacterial infection. And it happens even if you use fluoride, but it doesn't have to be a regular thing. I am a huge believer of the Xylitol products. Just real quickly, Xylitol, it is a natural sweetener. We actually make low levels in our body every day. You need to use Xylitol at least 5 times a day. And one of the things that I have figured out, guys, is that I place my Xylitol mint in with my pill carrier, so that every time I take it every 4 hours, my medication. So every 4 hours, I also take my Xylitol, and it's just easy. With your exam, because of the medication, I highly recommend that you see, you should have a checkup, I think, in my opinion, at least 3 times a year, just because of the medication and the dryness that we have going on. I highly recommend that you keep a daily journal. I'm still writing in mine. It's nothing fancy. It's just short notes. Things like, I slept good, I slept bad, the tremors were good, the tremors were bad. I document the days when I work on the computer. And I've even came up with kind of a rating scale for my tremors, just so I can kind of follow everything. I document when I exercise. Do I do yoga? I document the leg pain. I document the time that I know that it's time to go back and have an acrylic added to it. So you really need to keep a journal on what's going on. Now, I read somewhere that with Parkinson's disease that it's a journey, and that once we start this journey, it is a lifetime. But the ones of us with Parkinson's disease, we're not going to take the journey alone. And this is what I'd like to share with you. I actually found this healthcare team chart somewhere. And after someone is diagnosed with Parkinson's disease, your neurologist is going to be the #1 doctor in your life. Your next will be your primary care and your physician, assistance. However, there are other professions who can be valuable in the course of Parkinson's disease. Nurses are often your primary contact to the primary care provider and the neurologist. The physical therapists, they can design exercise to meet your needs. The social workers, they may help us cope with some stressful times. The occupation therapists, they can help modify the daily living. And then, of course, our pharmacists, we're all the time asking them questions. Your speech therapists, not only will they help you with your voice, but they can also help you if you have swallowing problems. Your dietitian, they're good at helping you design an eating plan for overall health. And the psychologists, they can help you better manage life with Parkinson's disease. But did you notice there's nothing mentioned about a dental profession? Nothing. But look, there's room for us. And I would love to see the dental profession added to this list of healthcare team. But you know, it's going to take each and every one of us to make this happen. If you are someone with Parkinson's disease, I urge you to request a TMJ exam at your next dental visit. You're going to have to tell them what's going on. If you're a hygienist or a dentist and you are not doing a TMJ exam, start. Take some classes. Learn about the occlusion. If you're a neurologist, I urge you to spread the news to your patients. This should not be kept a secret. I am not suggesting that dentists start diagnosing Parkinson's disease, and I'm not suggesting the neurologist or the medical doctor to start treating TMJ. I'm suggesting that we work together. Now, I had the opportunity to meet Dr. Stack in January this year, and he is a wonderful person. Plus, I got to thank him for all of his work on the research, on learning all of this about this appliance. If you're looking, I advise you to go and look up this Parkinson's Resource Organization and to see the dentists that are available that actually have been working with this procedure. It's under the Wellness Village. And this is Jo Rosen. She's the president and founder. I have not had the opportunity to meet her. I hope to meet her someday. We have exchanged emails and we've had a couple of phone calls. But this is also the place that if you want to do some more research, you can go into the archive newsletter and you can find some of the more of the articles that I didn't even touch on tonight. If you're a hygienist and you need some CE points, your components, I have a 2-hour CE on what do you know about the movers and shakers in your chair. We need to get this word out. This needs to be told. This is my web page for Xylitol. If you decide that you want to purchase some Xylitol, there's a place you can contact me and we can order it directly online from my web page. This is the website, the Parkinson's Resource Organization.org. If you have questions, please email me, carlagantz@gmail.com, or you can actually, this next one is my email address or my website for the Xylitol. Facebook, I would love for you to like me. Parkinson's disease and dental hygiene from the mouth of a mover and shaker. And I want to give out a big thank you to CareerFusion for giving me the opportunity to help get this word out, for helping me learn how to get my word out. I want to send out another big thank to Dr. William Funk for supporting me again, for learning how to take care of the splint and doing some extra studies that he's doing on learning this. And I have to thank my husband for everything that he does, for all of the support and everything that I get from him. And Shirley, I'm going to hand it back to you. Thank you very much.
Great. You know, we had this rehearsal the other day, and it's just always so amazing, all the things that we could be doing in dentistry and helping people in a totally different way. And thank you so much for putting yourself out there, Carla. I think it's really big, and it's a hard job to really put things out there like that. So we do have a couple of questions here.
Okay.
We have a question here. What was the fourth condition that TMD caused? And could you please explain dystonia?
I'm sorry, Shirley, what was the first question?
The first half is, what was the fourth condition that TMD caused?
The fourth condition? That
Yeah, I'm not sure. That was Colleen, so if Colleen could get back with us on that. The second half was to explain what dystonia is.
You want to take the dystonia? Now that's dyskinesia. Dystonia, I'm not sure that I have the exact, it is another muscle movement disorder. It's really about all that I can answer that one with. The dyskinesia is not in, that's from the medication. I'm sorry, I don't know that one.
Same here. We didn't learn that in dental school.
Well, I looked it up, and it says it's a neurological movement disorder in which sustained muscle contractions cause twisting and repetitive movements and abnormal postures.
Okay, so it's that's the reason it's saying that the appliance would also work with that.
Right.
Okay.
And then we were also wondering, have you been able to decrease your medication since you started wearing your appliance?
Yes, I have. I forgot to tell you that. I'm down to 7. It's gone in half.
Wow. So you
Yes.
cut them in half.
I've cut it in half. I sure have. I'm glad you asked that because I forgot to tell that.
Right. So which ones were you able to cut down most on?
It was the Compton, the COMTAN, and then I've actually cut back on the carbidopa-levodopa.
Great.
Yes.
So yeah, you probably feel better just because you're rid of those too.
Yes.
We have a comment about how nice your slide looked and how informative everything was, so that's always good. We have a question here for Dr. Funk. How do you determine on a regular patient if there is a need for a traditional splint or if there's a possible need for this type of appliance?
Well, I go by the history a whole lot for a regular patient, or by both of them. The regular patient still has to have, the way I learned at the Pankey Institute, the, what's the name of that split? I've forgotten, but whatever it is.
MRA.
Yeah, MRA, but that's somebody's name. Anyway, you look for wear facets. Of course, you look for headaches, popping, clicking, neck aches all the way down to the shoulder blade, pain, headaches somewhere on top of the head, but usually on the side of their head and out the shoulder somewhat, and certainly at the back of their neck. That's very, very common. A lot of times you'll see wear facets on the back teeth, but many times, if not most times, you'll see blunted canines. And the splint there simply, Tanner appliance, that's what it's called, Dr. Tanner. That appliance retains our heads if they don't have it before, canine guidance, anterior guidance, and removes any balancing or whatever it is, working contacts.
So,
and as far as the tremors, they've all come in with the tremors. So
okay.
I haven't had to diagnose anything. I just took the history and tried to treat them accordingly.
So knowing what you know now, this is a question for me, and having gone through this odyssey here, would you, if you found that a person had migraines, for instance, or some of these other symptoms of TMD, would you maybe ask them if they had pain anywhere else in their body, like leg pain, like what Carla was suffering with, and that would that help you decide what kind of an appliance to make, maybe?
I've never done that, but I will say, you talk about migraines. I had a friend of mine come in. He was a ditch digger, pick and shovel, I liked him. We got along great. And he was supposed to come in one day for whatever it was, and his wife came in instead. And I said, "Where is he?" And she said, "He's been home 3 or 4 days with a migraine headache." And I said, "Well, where is it?" And she told me, which is temples and on top of his head eventually, and down his neck. And I said, "Can he?" She said, "He just vomiting a whole lot, dry heaving now, and have to have all the lights out. He hadn't gotten out of bed for 3 or 4 days." I said, "Well, can you bring him in?" She said, "Well, I don't know if I can or not." So anyway, she did that afternoon, and he was a color of cotton. I mean, just absolutely snow white, and she had to help him walk. I went back to my office and set him in a chair, put 2 cotton rolls just behind his canines, one on each side, to prop his teeth open a little bit, and then spray chloromethane where it says spray, depending on where they are, different spots, depending on where you spray. And then I went on to treat somebody else and left him alone. I came back in about half an hour, 45 minutes, and he started telling me jokes.
Wow. Crazy. Crazy, crazy. All right, next question. Do you know if any, or Carla, can you go back a slide or two to show your contact stuff?
Sure
And
can.
then the question is, do you know if any other neurological disorders have been treated with this splint therapy, such as trigeminal neuralgia?
Yes, I can answer that. I've contacted a dentist, Dwight Jennings in California, that told me that he can relieve a significant amount of pain from migraine from fibromyalgia, myalgia, whatever it's called, that hurts everywhere, in about 80% of his patients, with a splint similar to this, not exactly. And these splints look simple, and they're not complicated, but they are very, very, very precise. If you don't do them just right, you can actually make things worse.
So are there special places to get lessons in how to do this? What's a good resource for making the splints?
I think Parkinson's Resource Organization was a good start. You can also just look up TMJ and Parkinson's,
okay,
and go from there. There's a jillion websites, and a lot of people. And I've talked to a bunch of dentists about this now, and not a single one has held back anything. They've been most forthcoming with information for me, and nobody's charged me a thing.
awesome.
They haven't done it.
They have to not.
Yeah.
Well, we need to get this out there more so that more people can be helped. Okay, so here's a long one from Angela. Just want to thank you for a wonderfully prepared presentation. I have acquired much more knowledge about Parkinson's and feel more comfortable to converse with my patients in the chair. She also liked the pre-webinar videos, which were emailed out prior. I hope everybody had a chance to look at those, that they are really a decent adjunct to this whole discussion here. Colleen wrote back about the 4 things for TMD. You had Parkinson's, Tourette's, dystonia, and something else.
Oh, okay. I know where she is now.
Okay.
Hang with me.
Lisa says thank you, and she enjoyed it. Diana thanks us and you guys and enjoyed it, and about your personal story, Carla. Teresa Bell.
I'm afraid my wife's going to go to the throat doctor in the morning.
Yeah.
Oh, Kyle got in too late with the time. We're going to try to always make these be at 8 o'clock Central Time. So set your mind for Central Time for these courses, for these webinars. Our next one is next week. So what is the best way to get this information out to other people? Linda wants to know.
Webinars.
Well, Carla can come and talk to your group.
That's what I was going to say.
She knows how to get on planes. Writing articles. I don't know how Dr. Funk feels about doing presentations, but that's just one way. The articles, discussions with your other care providers, I think, is another good way to do it.
That other disease was torticollis.
Torticollis, yeah. There it is.
I didn't mind that in dental school either.
Really have a whole new thing going on here about what you need to know.
Yeah, I think dental school should have been 15 years instead of 14 years.
Whoops.
Okay, so I'm going to take the screen back here, and we're going to close up here. That was pretty much the end of the questions. The comments are all great job. Everybody's very excited about learning everything here. And one of the big things that happened for Carla was the networking that she had at CareerFusion. I think she mentioned that a little bit. We saved a room here for everybody that's here in attendance for this webinar, and we would invite you to join us for this upcoming year. Our next meeting is next week on the 12th. It is another Spotlight webinar by Jody Heimbach. Here's Jody right here. We had a special day where no one called each other at CareerFusion this last go-round, and suddenly we all noticed there were a bunch of people that had animal prints on, so that's our little animal print picture. But next Tuesday, same time, 8 p.m. Central Time, on how to be a sales rep. So that's going to be really helpful for you too. April 9th is our partner webinar for PerioProtect with Julie Young. She's going to talk about PerioProtect. And our the week right after that as well, is our partner webinar with Crest Oral B and Lori Bernardo. So if you find us and follow us and like us, we would be very happy, and to keep you all in the loop of all the things that we do at CareerFusion to help everybody in the industry. So thank you so much. Thank you, Dr. Funk. Thank you, Carla. And thank you for all of the attendees that came. Good night, everyone.
Good night.